The next presenters are community consultants who are hired on behalf of the Living Your Best Life project to facilitate discussions with community members from across Canada. We hosted 5 discussions with key populations of people living with HIV in Canada. The discussions focused on what wellness and living well means in the context of living with HIV in Canada. Today, 2 of our community consultations will be highlighted. Asha will present on the youth group learnings, and Kenneth will present on the Middle Eastern, Southeast, and East Asian men's group learnings. I would like to invite Asha to start her summary presentation on the youth group. Asha, over to you.
Well-being is more like a journey. It's an ongoing process. There's always room to get better, to attain something new. I prefer the journey because there's always time and there's always room to strive to get better.
Wellness feels like the destination. I think the state of wellness leads to your overall well-being.
Wellness means a healthy lifestyle. It helps improve well-being.
Wellness brings growth. It helps you to do your day-to-day activities.
As a person with HIV, wellness or well-being means being alive. I'm here. I've got medicine. I can have children that don't have any problems. I'm good.
I know I am well when I'm having a good day and when things aren't bothering me. When things are not on my mind that lead to depression. When my mental health and depression are stable and I don't feel physical pain.
The most important thing for me is my emotional, mental, social well-being.
I like to focus on my mental health or my mental state. A good day for me is when it doesn't take me 3 hours to get out of bed to start my day.
When it comes to HIV, I really value peace. That means being at peace with the fact that I take medication every day.
Medication has stopped being a joke for me. It's just another step of being well. Seeing a doctor is another step. I constantly have to take steps to being well. Like doing blood work, making therapy appointments, meds, eating well, doctor's appointment, my cultural food as an African person, prioritizing self all day, every day, not killing myself over anyone.
Wellness or well-being to me means being in tune with myself. It means being self-aware with my mind and body. It means staying healthy, happy, life is stable, and feeling loved. That there is hope and that I mentally feel like there is hope. Emotionally, to feel loved and not lonely. To have someone to love you and you love them. That I am mentally and physically energetic, eating well, having no physical pain, relaxing, being emotionally positive, and not having a desperate soul.
Day to day, being happy.
That I receive encouragement.
That I am determined all the time, keeping myself distracted.
Doing activities with myself, like karaoke and dancing.
Community, society, and structural barriers cause me stress and negative feelings.
I go into mommy mode. If someone needs something, I take on responsibility. It's not a burden.
Stress affects me, especially stress from work, school, friends, and timelines. Everything is online for me because of COVID. Not being able to see my friends is kind of hard.
COVID has impacted where I live. Cases are lower where my mom is, so I had to live with her. I don't really have a choice.
The whole pandemic it's made things different. I can't go to parties.
There's nothing to do other than work. I'm worried about the vaccination and how it's going to affect my body.
Socially, COVID affects us a lot. We can't see our friends or people in general. Sometimes we have to walk outside just to remind ourselves that other people exist.
It's even affected me physically and practically. For example, I can't use the bathroom in public settings. I would have to go back home. This is especially an issue for those who are facing homelessness or close to homeless because they can't use the public bathroom for self-care.
Accessing services is hard.
However, I've been able to get my appointments over the phone, and I've been able to get my blood work when it's not busy.
The biggest thing impacting my wellness is the pandemic. Everything is affected. I can't go to the gym, which was important to keep me happy. We have to wear masks everywhere. Decreased connection with others. I can only use my phone.
I work in a medical field in a pharmacy. I have to keep myself safe, but also my children. I'm balancing money and the health of my children.
Heterosexual men, they negatively impact me on a daily basis.
The pandemic has not been detrimental to me because I'm an introvert. It's helped me realize that I need to do self-care and rediscover myself. It's helped me realize what I'm passionate about, like social justice. And I even found a job in that field. I also started a podcast. I have time for self-reflection now.
I learned a lot more about myself because of the pandemic. Before, I wasn't one to speak up.
Blackness has always been very exhausting. This year has been particularly very tiring. We're constantly experiencing loss, despair, and helplessness. I'm tired of hearing about the death of people that look like me. I mean, it's always been happening, but somehow white people are just discovering racism in 2020, and that it is true that systemic injustice exists. I'm tired of having to take care of the white people around me. I'm sick of the expectation that I have to educate and make you feel better about your whiteness.
It's really hard navigating the bureaucracy of having to apply for things. It's made difficult on purpose. Applying for work, programs, and government assistance, it's difficult.
I track my well-being. I paint my nails each weekend. If they're all picked off by the end of the week, I know that something is going on. It's a way to track in the moment and a reflection. I ask myself what it is happening around me that is making me pick my nails. I'm trying to do a prayer journal. I write out my prayers to God. I sometimes need to talk it out. I will vent to my friends if they are willing to hold that space for me.
Talking to myself in the mirror, telling myself it will be fine, and doing self-affirmations while I'm doing my own hair.
I just give myself TED Talks every morning as a routine.
I don't want to do anything. I am depressed. It is a sign that I want to improve my wellness.
When I stop cooking or doing the things I like, or I get messy, it is a sign that my wellness has decreased. I try to have representation in everything I watch or listen to. I listen to Black podcasts, read Black authors, and Black feminists like bell hooks. I love seeing that there are people out there fighting for justice for my community. On Netflix too, I watch anything that has representation. I don't want to be bombarded by you-know-what.
I wish there was more focus on HIV stigmatization and discrimination, especially in communities that have more stigma.
There needs to be more education about U equals U in PrEP. Not enough people know about it.
I'm tired of school and teachers that don't understand the true facts of HIV. They get the info wrong in health class. But for those of us living with HIV, we don't want to correct them because we don't want to disclose our status because it's uncomfortable.
We need proper sex health education in schools. We have to do our own research in order to figure things out. It is really hard to be an advocate for yourself, especially in the school system.
People who work in HIV care, can you do things a little faster? Reduce the wait times?
Do more drop-ins, not making appointment times.
I need more support, especially in the time of COVID.
We need financial and emotional support. I have volunteered for PWA for food delivery. There are so many HIV survivors with a disability not able to get food because of COVID. There needs to be more effort in making sure that children living with HIV know they have a community available to them. They need peer connection, making sure they have access to programs. We need more organizations, like the Teresa Group, that is focused on HIV-positive young people and their families. They also need more funding. I don't know where I would have been without that community.
ASOs help HIV-positive people get real opportunities to grow professionally. We are tired of the mass volunteerism and the low-paying jobs. Give us opportunities that will actually help us in the future. Training that doesn't have AIDS plastered all over them, because listen, we can't take that anywhere. Give PHAs real opportunities to impact the lives of other PHAs. Because guess what? Nobody, and I repeat, nobody understands the needs of people living with HIV more than HIV-positive people.
Amazing. Thank you, Asha. I'm still really in for it. That was an amazing video. Thank you so much. I will now invite everyone to watch Kenneth's presentation on the Middle Eastern, South, Southeast, and East Asian Men's Group. I'll hand it over to you, Kenneth.
Hello, everyone, and good day. My name is Kenneth. I am one of the community consultants for the research project, Living Your Best Life. My co-consultant is Mikiki, and the group that we consult is the Middle East, East, Southeast, and South Asian MSM group. I'd like to acknowledge the meeting place of Toronto is the home for many First Nation, Inuit, Métis people across the Turtle Island. I am grateful to have the opportunity to live and work in this land. This group, we have 10 participants. Average age is from mid-30s to mid-60s. Overall, the session was very interactive, engaging, and respectful. First, we want to find out if the group preferred the word wellness or well-being. Clearly, the word well-being is the winner. The group preferred because it is more personal and holistic. Instead of just focusing on the physical part, they also can be related to the mental, emotional, and spiritual health as well. When it comes to wellness, The word wellness, they find it's not too personal. It's more clinical and medical term. And also it is such an Asian culture to use the word wellness in many Asian countries. We also ask the participant, when it comes to physical, mental, emotional, and spiritual health, based on the indigenous medicine wheel, how it impact on their well-being. The group feel that physical health is especially important to them since they find out they are HIV positive. They are feel more connected to the healthcare system, and also living with HIV, they're also concerning with comorbidity and other opportunistic infections. When it comes to mental health, they are very focused on their state of mind, especially living with HIV. They trying the best to turn all the negative behavior into positive behavior. Some participants are also in the aging process. They express they have some absent-minded, but not to the point with dementia. It is such a roller coaster when it comes to emotional wellness for participants. Sometimes they feel happy or sad, but many participants express they will find way to make peace within themselves by focusing positive thinking. This group is not heavily emphasized on spirituality, especially related to their own faith. I think they are very self-reliant and be water. We continue to ask the participant, is there any outside factor such as community, society, or structure barrier that affecting their well-being? The group feel that community is very important to them. It's a sense of belongings. They can increase the social connections and reduce the social isolation through community. On top of it, they also think that peer support is as equal as important to have the community. HIV stigma, discrimination, and disclosure is part of an impact when it comes to society. I remember one of the participants even mentioned that he don't even know what stigma is all about until he is diagnosed with HIV. Another participant, he is very mindful and compartmentalize himself to disclose his HIV status on how, when, and where to disclose, especially when this individual is living in the suburb area. When it comes to the structure barrier, many participants agree living with HIV in terms of job opportunity, income, security is sort of very limited for them to seek or access. And even one participant so worried about is there enough food to put it on the table. We also want to find out when they're going to take action to improve their well-being. Well, a lot of participants even mention it. Well, I want to be focused on my diet and nutrition. I want to increase my social connection, be in touch with the nature. And also many of the participants want to do activities such as physical exercise, yoga, Tai Chi, reading, watching TV. But one participant really stuck out to me is he will do it as a virtual on every day. He will find time to play video game as part of his self-care. Lastly, we're asking the participant, how did COVID-19 impact their well-being? Of course, many participants mentioned, well, I'm so worried, they don't want to contract the COVID-19 virus. So because of a lot of uncertainty and anxiety, they have to be very cautious and mindful. At the same time, they want to do physical activities. Instead of doing indoor, they try to do most of the activities outdoor. One of the participants stating that playing and walking his dog is to maintain his physical and mental well-being. And it really resonates with me because I also have a service guide dog, which I walk my dog on a daily basis as a physical exercise and walking meditation. I'm so ecstatic to be able to consult this group because my own impression about this group, they already accept and move away from their HIV identity. They are knowledgeable and grounded and focused on the well-being. Thank you. And I hope all of you can continue a positivity to live your best life.
Thank you so much, Kenneth. That was a great presentation. And thank you again, Asha. We're really appreciative of our community consultants, and they got the voices around Canada of people living with HIV that we may have not been able to connect with. Tomorrow, we will hear from our community consultants, Jackie on the women's group and Chantel on the overall recaps of them. So I would love to lead us in our discussion plenary. Love to get into that. Many of you will have been part of this discussion at our last meeting on Monday, where we introduced the sailboat analogy and talked about the wind. For those that were not at the last session, I'll briefly introduce you to the idea. So in this model, the individual living with HIV is the entire sailboat. The sails represent 4 areas of the medicine wheel holistic healing map: spiritual, emotional, physical, and mental. The wind represents things that propel this person towards the goal of happiness. The anchor represents things that hold the person back from achieving optimal wellness or slow them down at it. The icebergs represent obstacles that could become barriers to optimal wellness in the future. The water represents systematic factors, positive or negative, that can contribute to optimal wellness in the context of living with HIV. So on Monday, we did discuss the wind, and I do believe we have those notes as well. But today, we will be discussing the anchor and the icebergs. Although these represent things that can detract from optimal wellness among people living with HIV, remember that on Monday, we came up with a variety of assets and strategies that people living with HIV propel them forward despite these obstacles. And so now we're talking about what these obstacles may be. So let's start our discussion today with the anchor, things that hold a person living with HIV back from achieving optimal wellness or slow them down. For anyone in the room who is living with HIV, if you do feel comfortable speaking from your own experience, we truly would appreciate that and want to put people living with HIV at the forefront of the work we're doing. But everybody in the room would love for you to share, in the work that you've done and things that you've heard. So some questions we're looking at is, I first want to ask, what keeps you from achieving your optimal wellness?
This is Asha. I would say one thing that affects me is not having enough time to do things. In the day, I just feel like time is running away with me, and like I have to do work and like help out with family and all this stuff. So sometimes I notice that I have to take a back seat, and my needs and wants needs to be pushed back in order to get things done.
Absolutely, thank you. What puts a damper on your spirit? What gets you down? And we'd love to hear from everyone.
It's Bob. Maybe I can jump in here, could I? Because we've talked about aging and stuff, but this has to be one of the biggest barriers to engaging, to advocacy, to looking after your own health that I can think of. And I speak from experience now as somebody in their 70s. Ron talked about comorbidities and touched briefly on sort of practical issues, but some of those practical issues loom very large for people living with HIV, and things we hardly ever talk about, things like loss of hearing, eyesight, mobility. There aren't many people who, in an older age group, who aren't dealing with some of these. So, I get sometimes frustrated when our conversations about aging don't reflect the real practicalities of being an older adult. And I'll leave it at that. But for me, I can say it becomes increasingly a barrier, not only to doing things like exercise, doing some of the wellness things. It's hard to exercise when you can't walk very well, or see very well, or hear very well. So, and this is something that affects so many adults. It's not funny in the HIV population. So I think when we talk about, and it also affects the kind of engagement. This is why we don't see many adults from that population going through the doors of AIDS service organizations. First of all, they have a lot on their plate dealing with comorbidities, but they're not always able to take the practical steps of getting there. So for me, I can't underemphasize, or is it overemphasize, one of the two, the impact of aging on our ability to really do some of the wellness things that would really be good for us if we had a better, sounder mind and body. So I'll leave it at that, but I can't help, I just wanted to throw in that we sometimes think of aging as this sort of concept, but really it consists of a bunch of barriers that a lot of us are having to navigate, to engage, to keep well, and I'll leave it at that.
Thank you, Bob. I heard an echo. Does anybody else have anything to share? The question was, what puts a damper on your spirit? What gets you down? So I know for me, it can be a range of things, watching the news probably ever since March 2020 has been, I mean, even before that, because like Donald Trump was just doing all the stuff, but like, I was like, it's fine. He's a comedian, whatever. But I mean, everything with COVID and you're just learning about the lives that have been lost. And then, all of the uprising with Black Lives Matter in June and kind of, I love to be on social media. So I would kind of just suddenly see somebody like post a video of something that I want to see somebody look like me get violently attacked. So that would kind of put a damper, but also just people not, I mean, maybe in my mind I expect so much from people or I expect something, but I can give an example. Like I might see like a very cute man, okay, and I'm like, yeah, that's my husband, everything, and then you might start to get to know them and eventually disclose, and they're ignorant or just not educated, and that kind of, because I already made up this fantasy of this is my husband and we're gonna get a 4-bedroom house and this and that, I get disappointed by that. And I think that as much as I know in my mind you can't control other people, it's not even when you I posted a YouTube video disclosing, you get 100 positive comments and the one bad comment can put you down as well. So I think that's definitely feeling reactions from other people.
Malupa, we have a few other comments in the chat.
Okay. Oh, thank you. Thank you for putting that out. So let me look at this.
So Larry says, once one health issue is finally managed, another one pops up.
Another one pops up. That's a very good point. And intern forces, do you think talking about aging with HIV is just the day of born? Can you really explain what it is? Yes, I think Bobby explained that. I think he did. Jason mentioned a lot of my BIPOC patients have really been affected by the events that have led to BLM protests. I'll agree it's good to see the movement gaining traction, but it's still bringing that stuff to forefront of their minds. Yeah, definitely, and people can react to that from trauma, and it's disappointing, definitely. From Larry, oh yes, one health issue, yes. So any other comments? And I'll go to the next question, which is, what makes it harder for you to do the things you want to do? I mean,
I think we just were asked that question, weren't we? Anyway, for me, winter, cold winter. This is Brenda speaking. I'm 72. I'm catching up to you, Bob. And getting around, because I walk to the store and so on, and it's treacherous out there, but nonetheless, that is a deterrent. Plus, we're in a lockdown, so there's nowhere to go. That keeps me from doing a lot of things, going out. Cold weather too. My dog doesn't like the cold weather.
Great point. Thinking of practical things, I think, money makes a lot of people not be able to do what they want to do. Money can't buy you happiness, but it can help, we say. So that's something to look at: housing, food, the proper nutrition to actually be able to do what you want to do. And I think there's a big difference between need and want, and they're both just as important for humans.
When people talk about COVID and how they're living now, I say, welcome to my world. Because without money, you can't be out shopping and buying things or going to restaurants or whatever. Without a vehicle, you can't go very far. And with COVID, I don't even want to go on the bus. So I'm walking within a kilometer radius around. So my neighborhood has become, which thankfully I live in a wonderful neighborhood, but near the lake and so on, and I'm happy in my home, but it makes me become
ma maison avec mon entourage, mais je suis presque
just to keep sane. And I have friends who are much younger than I am, like mid-40s, and I have a couple of them, actually, they don't understand my fear of getting COVID, that I don't want to be exposed to it. Both of these people are out and about, one particularly, and it distressed me very much this week to actually have to tell her that this lady is transgender and she has problems, and I have to send her away. It makes me feel really bad. So that will upset me for several days, just doing that.
Thank you for sharing. I know that for me, when I was younger, and I have talked to other youth about this, kind of when you're younger living with HIV, even if I would be, 12 or 14, I've lived many years with it, I want to share my experience, or I want to advocate more for myself. And that's at a point where you worry that you could disclose your parents, or your parents say, no, this has to be a big secret. And so sometimes it's those family dynamics that stop you from doing what you want to do. People staying in the closet, a variety of reasons. Asha said depression and anxiety are big ones. Those can just stop you from moving or trying to achieve what you want. And Jason is putting Kelly O'Brien or Ron on the spot. He's kind of volunteering both of you in the chat. He wants to know, do you have any reflections from the exercise and HIV project in terms of barriers?
Ron, do you want to go ahead, or? Oh, okay. Okay, Ron's asked me to go ahead. So thanks for the question. I think lots of reflections and lessons learned about barriers, but also facilitators to engagement in the community-based exercise study. For those who might not be familiar with the project, it was a collaboration with the Toronto YMCA and involved engaging with a YMCA personal trainer once a week and a combination of aerobic, resistive, flexibility, and balance training. And participants were encouraged to exercise 3 times a week. They could engage in group-based classes, but attend once a week with the coach. And one of the, I think, facilitators of that intervention was definitely the one-on-one with the YMCA staff. The comments we received from a lot of the qualitative interview data actually was about the appreciation of just learning a little bit more, capacity building, having a discussion around goals, abilities, and interests of physical activity, and the intervention being tailored towards that. But getting on track and just, I think, looking forward to engaging in a form of structure and routine. And as far as some of the barriers, certainly periods of wellness and periods of not so wellness or well-being came into play. And I think at the end of the day, when we looked at the adherence to the intervention or exercise over time, it came down to things such as life getting in the way of whether that be work, travel, family commitments, but also episodes of wellness and episodes of illness as well. So really episodic health resulted in episodic exercise. And I'll leave things there. And anything else to add, Ron?
The only thing I would add, I would ask you, Kelly, is whether cost was a factor for some people not being able to continue. Because, you know, during the study, it was very luxurious to have one-on-one training and access to the Y. And as much as I think the YMCA is a wonderful place, it's not cheap.
Yeah, thanks for bringing that up, Ron. That's a very good point. So as part of the participation in the study, participants were provided access to the trainer once a week. So that was 25 sessions over the course of 6 months, but also provided a YMCA membership that allowed them to access the facilities for other periods of time. And we also looked at a follow-up period of 8 months where participants no longer had access to the one-on-one training, but they were still provided an 8-month membership at the YMCA because we wanted to see what the level of sustained engagement. And for some who had the ability to pay out of pocket to continue with the personal training, did so, because that was such a gem in terms of the key ingredient, I think, that drew people to physical activity. So I think at the end of the day, accessing types of gym environments or traditional forms of gym environments and the cost associated with that is a barrier. I think, you know, one of the challenges, I think, and this was an implementation science approach, and we always talk about what the feasibility is of the sustainability of something like this happening down the road. So, you know, really hoping that there may be models that can pick up on this and partnerships that occur and that happen to allow for longer term programming and sustainability. And, you know, I think now, speaking from the YMCA, who are just involved in a session earlier this week, they have made some, during COVID, they've made access to some of their online classes online free of charge. So I think, you know, as people have pivoted to online strategies with COVID, I think some fitness facilities have tried to do the same, but certainly that is a barrier for some accessing those traditional gym environments in person and accessing training.
Thank you so much, Kelly and Ron. So I'm wondering what clouds you're thinking or affects your mental well-being? What could possibly? I think that it's hard to be mentally well or just, okay, always think positive when you are going through something rough, you know, when there's not money in the bank, if there's not, you know, there's some sort of circumstance happening. I think there definitely is that that can affect your mental well-being. Anybody else?
So Kelly here. I think over COVID, the last year, I've actually realized that I never thought I had anxiety, but yeah, the anxiety about COVID and getting it as an HIV positive woman has really, and then the lack of connection too. Zooms are great. I love seeing all of you. I know some people in the room, but the sitting at the Ramada is not the same, right? So being at the Ramada and having that personal connection is can be is a lot better for your mental health. So the community connection to family, and all that stuff, right? And then the lack of personal connection, so love, and that can really, mentally has really mentally played on me. And being in a rural community of Muskoka is hard. So yeah.
Absolutely. Thank you for sharing. And I see Valerie in the chat has said the lack of funding for ASOs and the closing of many, they gave a lot of place for connections, support, and a place for a safer space, which is very true. And we're seeing all of those, slowly closing. So we've talked about a lot of these anchors and what they involved. So I want to know, what are some of the ways to lift the anchor when these things happen? Are there strategies or tools you use to move forward when you feel like something is holding you back?
I think I'll build on what I just said. So in realizing all of what I have just said, I pulled my books out. I pulled out books that I have gone through training around, better breathing, physical exercise. I've actually, I have a German Shepherd, so now I go out for 3 walks a day, morning, afternoon, and night with him. I try to get out during the weekend, one day a weekend, and find a nature trail, because again, I'm in Muskoka, so we're pretty rural, to get out of the house, right, and get my eyes off of Zoom and away from my phone. So that's some of the things that I've put into place around that to help with my mental health.
That's awesome. Dog walking, yes, it's definitely something a lot of people can connect to. And even dog walking in the winter, I commend you. I wouldn't be that. But I think for me, sometimes just like sitting down and praying just kind of brings everything to focus and is a part of a meditating factor. But I also find just calling up a good friend or getting on Zoom, it does suck. We can't all actually reconvene and be together, but really just ranting and venting. I just need to get it out, because I will feel like people have silenced me for too long. So I could just talk to a good friend who will let me rant it all out, and just talk to their ear off. I'm kind of exhausted by the time that I've talked, and then I've slept, and then I woke up and not remembering why I was mad in the first place. What does everyone else do to kind of lift those anchors that you feel like holds you back?
Asha here. I'm just gonna say spending time with family.
Thank you. Absolutely.
I find that I'm motivated by necessity. I have 2 animals, and I ran out of dog food yesterday. I'm having a problem buying animal food because you have to order it, and then if it doesn't, the animal doesn't like it, like my cat doesn't like the last food, you can bring it back, but not during COVID. So I go out because I have to, and then once I go out, I'm happy that I did. So sometimes I just need a push to do that.
So thank you. What else? what have you observed that works to help you lift the anchor? So when you think about a time when you were just really down about something or couldn't really get in the right headspace, what are you looking back on that has really lifted the anchor for you? I know somebody that I work. Oh, sorry. Go ahead. Kate.
Sorry, Maluba. Lots of people in the chat are sharing.
Oh, okay. Yes. Perfect. Getting outside. Very true. Outdoor walks. Dogs are everything. I like that. Return to culture drums. Sing, dance, and create. Rattle in drums. Walk in nature. Take the time to see something new. Pick up garbage. Great exercise. Netflix. Huge one. Music. Okay, really, really great.
Yeah, I have a comment. Right. So for myself, people make me happy. In the time of COVID-19, they connected. And that was my happiness, to see people, to sitting down, to chat, to cry, to laugh, to eat together, to talk anything, relationship, but everything is gone. So for me now, what I did is just to bring back, what is the plan now? To bring back my people, to see them and talk to them. The matter is there is barriers, but is to see people and then a connection. That connection. We talk about money. Money is not everything. Yeah, we need money for something, for needed, but without a peace, without forgiveness, without love, and if you have million and a million of dollars, there is nothing. You cannot have, you cannot feel you are human. So I think I thank you, realize, to bring this implementation, to bring this idea in the table for us who is HIV positive.
Well said, Chantal.
Yeah, to discuss. Thank you very much.
Of course. So let's talk about the icebergs, obstacles that could become barriers to optimal wellness in the future. Again, let's start by hearing from everyone in the group. So what is something that you think could pop up in the future that might interfere with your wellness? Or is there anything that could be done now to prevent this from happening or to steer this potential obstacle down the road? And I know thinking along, you can't always be prepared for the worst necessarily, unless you have like a bunker for tornadoes and all that, but kind of, what are some things that you think, okay, this could happen in the future that could interfere? What is there that I can do in advance to kind of potentially block that obstacle?
Maluba, there's some stuff in the chat.
Okay, thank you. Aging. No. Oh, Bridget, you were talking. Sorry, we can't hear you.
I think can you hear me now?
Yes.
So I think what Bob was saying is that, aging and, being better prepared for what's to come, because we're all going to meet some sort of obstacles. And, with aging, it's about being together and talking about the elements and how we can overcome them, and, being better prepared as a community, because we haven't talked that. We haven't gone through that research. We don't know what to prepare for. And I think it's a scary thing for a lot of us to be going through that. No matter if you've been born with it or if you're living with it for X amount of years, we're in the same situation, right? When it comes to HIV and aging. So I think it's better preparing us as a community of what's to come.
Absolutely.
Yes, I've been talking about HIV and aging for a while now, since I've aged. And finally, with Panache is having the first or arranging to have the first study across Canada of persons living with HIV over 50. So I'm really looking forward to that. It's about time, right, Kate?
Absolutely. And Larry says loss of independence. That definitely could be that. Kelly says not being able to see the doctor, which is in the GTA area, that lack of support. Exactly. And it's not, again, I mean, maybe some people, but we never saw COVID-19 happening, and then these things shifting and having to then put a plan in place and go with everything. So for everyone in the group, can you think of anything that might change in the life of a person living with HIV that might negatively impact their wellness? What, if anything, could be done now to prevent that thing from happening?
Maluba, it's Kate here. Just coming to mind in my work around aging, I think we always need to work at maintaining our social safety net. So I think that it's always under threat that some of the provisions that are available to people, say if they find themselves unable to work or unable to live independently or to take care of their wellness in some other way. I think we always need to work at maintaining the system that helps support people.
Absolutely. Thank you. Anybody else? Big change in benefits. Larry mentioned body parts wearing out, so try to keep moving. From Ron, Yasmin mentioned resilience, so building resilience. I know Joanne mentioned a loss of doctor, family physicians, doctor retire. And I know Maureen had talked about it before, that was like, you know, everybody in her like circle had the same, you know, gynecologist or dentist, because you wanted that trusted source. Valerie said education. We need to stop stigma and discrimination and support those that face self-stigma. So I do love that, Valerie, that yes, we need to stop that and stop that, you know, that internalizing of self-stigma. So I do want to remind us of the things that we said to overcome these obstacles. You know, people said that they go outside and take a walk with their dog. People said they eat chocolate. Okay, nobody said that. I just thought that. People mentioned, you know, get their body moving, get some exercise, praying. So there's all these things that we have these resources in to kind of get us refocused, and that doesn't necessarily make the problem go away, depending on how big it is, but kind of does make us more in control and get to relax ourselves a little bit. So I think that's really important. Anyone else have anything they want to add on our icebergs and anchors for our sailboat? We will be continuing it tomorrow. Okay, awesome. Thank you so much. That was great to lead that discussion. It was such a rich discussion on wellness for key populations today, and then having that discussion of the sailboat. Thank you all for participating. And I want to ask if there's any, you know, comments on the day. Jason or Tammy, do you have anything to add?
Hi, Maluba, it's Tammy. Can everyone hear me?
Yes.
Yes, okay, great. Excellent. Day 3, I think we're really building on what we started with in terms of the day 1 with the holistic framework, and then day 2, and really leading up to what we'll continue tomorrow. But I think what stood out for me with all of the amazing presentations today was what Yasmin said around trans communities. And, you know, saying that we can talk about wellness and well-being makes an assumption that all of the other factors and facilitators for getting to wellness or getting to well-being are even being met. So there are many communities, I think, who face the same challenges, but at least we're having the discussion and naming and calling out, speaking truth to power, I think is step one.
Absolutely. Thank you. Jason, any closing thoughts for the day?
Yeah, I just wanted to echo that I thought today's discussion and the last two sessions discussions have really brought into focus a few things really clearly about the importance of connection, of community building, of culture, and how those are really essential to save people's lives and to make that resilience or build that resilience that's going to get us past the icebergs and past the anchors. And so it's been, I agree, really rich conversation and discussion, and I'm really looking forward to another day of discussion tomorrow.
Absolutely. I echo both of your comments.